Hello everybody, welcome back to Tip Tuesday. I am Dr. Cindy Nagel at Horizon Dental in Kamloops. Thank you for anybody that sees this video and joins me today. Today I'm going to be talking about a new kind of beauty trend in the dental world, activated charcoal toothpaste. So right now, I'll just introduce the product that I chose. This is another product made by the Humble Bee. They also made the coconut oil that I talked about last month. Basically, activated charcoal toothpaste. It just looks like a black paste. There's nothing really terribly special about it. I chose a mint flavored one, so there's mint essential oils in here. Some of the other ingredients are organic coconut oil, of course, the activated charcoal powder, a bentonite clay, and then the essential oils for the flavor and the smell. So, first of all, I thought that I would just briefly review, what makes teeth go yellow? Why do people want to whiten their teeth? So it's mostly about how the light affects your teeth or how the light shines through. So of course, the white of your teeth is the enamel, it's the outer layer, and the inner layer that the light penetrates to is more yellow, and that layer is the dentin. So first of all, one of the things that can actually affect the color of your teeth that people might not think about right away is your complexion. So if you're a really fair person, like a redhead, for example, your teeth are going to appear to be more yellow even though they're actually a normal color. Same thing goes in the other direction. If you have a very dark complexion, if you're African, then your teeth are going to look very bright and very, very white in contrast to your skin color. So that's something that, a lot of people I don't think about. Of course, there's a lot of surface stains that also affect the actual color of your teeth. So coffee is the reason why my teeth are not as white as they could be at the moment. Wine, other foods like berries, things like this, they can all change the color of your teeth. Tobacco products are a very common reason why a lot of people will have stains on their teeth or darker teeth. Plaque and tartar also will stain. So plaque will make the teeth appear to be more yellow. The tartar will actually often stain black if it's old enough. So if there's black bits kind of caked on your teeth a little bit, that's what happens with the tartar. So also older fillings, veneers, crowns, so any sort of fillings or work that you've had to your teeth. One thing that I'm not sure everybody's aware of either is that teeth naturally change color as we get older, but those fillings, those veneers, those crowns will not change. So sometimes you have to kind of roll with the punches when it comes to these restorations. Recession is another reason why you might see some changes to the color of your teeth. Hi, Sherry. That's because the roots tend to be darker than the crowns of the teeth because the roots don't have any enamel. So those are some sort of common reasons why people might have darker or yellow teeth. So next, I'm just going to quickly review what activated charcoal is, which is the main ingredient in these toothpastes. So basically, we all know about charcoal. It's something that's used on the barbecue, right? It's used for cooking. But activated charcoal is actually created by heating up the charcoal with a gas. And this creates large spaces in the charcoal, and it makes the charcoal very absorbent. So that's why some people might remember the way back in the day, maybe they still do this, but if you had poisoning or something, they would make you eat charcoal so that it would be absorbed into the charcoal in your stomach, and then you would hopefully not be poisoned anymore. And so that's kind of the thing with the activated charcoals, that it does have some medicinal purposes. Unactivated charcoal, so the stuff you put in your barbecue, that's actually a carcinogen, which means that it has been associated with creating cancer if it's ingested. So don't eat the charcoal out of your barbecue. Don't crush it up and make it into a toothpaste. Get some activated charcoal powder if that's something you want to do. Other medical uses, they've used it for different things like in the past, apparently to lower cholesterol. So it has some kind of odd medical properties, but the number one thing that I think of is, again, to absorb toxins. Some people in the past have used it for detoxing as well. If you're going to detox, I recommend that you do that with a professional. And then there's quite a few beauty trends recently that have come up, you know, in the last little bit with the charcoal. So facial cleansing, so they're using it in some cleansers, which I've also tried. I didn't mind it, but I found it really hard to wash off. It's obviously very dark and black, so you know, I kind of find it down here if I didn't get it off enough, so I stopped using it. And then, you know, toothpaste is the more recent, you know, use for this stuff. So apparently, I also found when I was doing some research that it's been a part of the regular dental hygiene in some rural parts of Africa and Southeast Asia. So in those areas, they've been putting activated charcoal into their oral hygiene products for a very, very long time. So why are we using it in toothpaste for whitening? It's because of what I mentioned before, how absorbent the charcoal is. So it's hopefully meant to, you know, sit on the surface of the teeth. And if it sits there long enough, and what does this one say again? 3 to 4 minutes, so not too long, it's going to absorb the stain and the buildup off of your teeth into the charcoal, into the paste, and then when you rinse it off, it's supposed to come off with it. Another thing too is that the charcoal is highly abrasive, which is a common element in any whitening toothpaste. So any commercial stuff like Crest or Colgate, if it says whitening, it's because of the abrasiveness of those toothpaste. So you have to be very careful if your enamel is thin or you have sensitive teeth, because that can make it worse if you're using something that's highly abrasive. Like it's like rubbing sandpaper on your teeth if you do it aggressively enough or often enough. Which is another reason why, you know, it says to only do this, you know, once or twice a week. So let's see here. One of the other things that people have kind of put out there when they were developing some of these toothpastes is that the activated charcoal will fight cavities. I didn't find any scientific evidence that the charcoal has any effect on cavities. Of course, it's one of those things where, I mean, if you're brushing your teeth, then that's going to help prevent cavities. But I didn't find any research, any evidence that the charcoal itself actually has an effect on that. So keeping that in mind, I'm not sure if that is something, but it's more anecdotal than anything else. It's not proven. Another thing to keep in mind when I was mentioning before that any discolorations that's related to, like, say, veneers and crowns, the toothpaste like this unfortunately isn't going to change those colors. You either need to have your teeth commercially whitened to try and rematch to those older restorations, or you may have to replace those veneers or crowns or bonded fillings, things like that. One other thing too, because this only works on the surface, it's not going to work for any of those intrinsic stains. So the color of the dentin itself, that is not going to be affected by the surface paste. And when I was using it personally, I found that it wasn't really able to get into those spaces sort of in between the teeth, where some of our commercial whitening products, you know, actually do work quite well in between the teeth, but I found that this didn't really get there. Okay, which brings me to my next point. I do have a list. There are several ways to whiten your teeth. My preferred way is to use the in-office whitening. We use the Zoom White Speed. So when we do that in the office, it involves separating your gums and your cheeks, so the soft tissues from your teeth, using a rubber dam and a matrix to you know, sort of protect those. We place the bleaching material on your teeth, and we use a light to activate that material. The light speeds up the process, so you can see almost immediate results, and I'm not a very patient person, so I like those immediate results. There's also take-home trays, so we can make customized trays to fit over your teeth, and those trays can hold a bleaching material that you can apply at home. I find that this is a really good way to do touch-ups afterwards. So again, coffee lovers, if you get your teeth whitened and you find that the coffee is restaining, the take-home trays are a really inexpensive way to touch that up. One of the easiest ways I find when it comes to trying to get rid of surface stain is to actually get my teeth profied or polished by my hygienist. I'm spoiled because I work with these wonderful ladies every day, so I have that opportunity. I know not everybody out there does, but keep in mind that sometimes all you really need is to just have that polish professionally by one of our hygienists, and that will also improve the color of your teeth. I already mentioned that there are several different types of abrasive or whitening toothpaste on the market, Colgate, Crest, things like this. I think Tom's also has a whitening toothpaste that I haven't tried yet, so don't take my word for it. But there's, again, that's to attack some of the surface stains. If you're using any sort of abrasive material, please limit that to only a few times a week where possible. And again, if you really do want to have, those perfectly white teeth, veneers, crowns, or bonded restorations might be an option. So just keeping all of those different options in mind. So finally, my review of the charcoal toothpaste. I'm not going to get super close to my computer because I don't think that it'll show up very well, but I found that it didn't make a difference for my teeth. I've been using the toothpaste for a month, so that's twice a week for 4 weeks. And at first, I thought that it was actually making a difference and I actually have a photograph in the comments of my event on the Facebook page that shows my teeth with the charcoal on it. It's very, very dark and black, and it's really kind of scary looking at first. So the first couple of times that I used it, I thought that I was seeing a whitening effect. But when I rinsed off the paste, I could still see all the coffee stains on the front of my teeth. And I do find that since, I've had braces and things like this on my teeth, they do accumulate some stain on the front more than they used to. So I was hoping that this was going to be the trick for me, and then I wouldn't have to bother the hygienist so often. But what I found was that once I rinsed the black off my teeth, they seemed whiter, but the stain wasn't gone. So I think that it was just a trick of the light where, because my teeth were black, once it was rinsed off, they just seemed whiter. But I found that the stain was still there. So even today, after week 4, the stain is still on my teeth, and I think I'm going to have that polished off at work tomorrow. But that doesn't necessarily mean that it won't work for anybody else out there. I know that there are some people that do find that it works very well for them. So like I said, for surface stain, extrinsic stain, the food stains, it's going to work because of the abrasiveness. Possibly because it will absorb the stain molecules off your teeth if you let it sit long enough. So just keeping in mind that I recommend that you only use it a few times a week. It shouldn't replace your regular toothpaste. So that is my review of charcoal toothpaste. I found that it didn't work very well for me, but I'm curious to see if anybody else out there found that they did like it and that it worked for them. Of course, there may be some comments, hopefully later on in the notes here, that people can share their experiences with this toothpaste or other brands that they've tried. Like I said, I went with the Humble Bee because I use some of their other products, so it was very convenient. This is going to be the end of September's Tip Tuesday. I will be delaying October's Tip Tuesday until after Halloween, which is on a Tuesday. I'm very excited about Halloween. And in honor of, the wonderful candy-filled holiday that we have at the end of next month, I'm going to try and make what seems like a boring topic interesting and talk about toothpaste and why some toothpastes are superior to others, and why if you do have a child or you yourself, love your candy, what options you might have to change up your toothpaste, and that might make a bit of a difference for you later on. So again, if there's any questions or comments attached to this video later, I will do my best to answer them. And thank you everybody for watching however much of this video you watched, and I will see you after Halloween. Good night.